As we all know, the world pretty much changed overnight in March of 2020 with the emergence of COVID. And then healthcare was particularly impacted when the public health emergency was declared. What the PHA enabled was the rapid deployment of point solutions because you had co-equal reimbursement for all the services, and you also had a relaxation of a lot of requirements around what the technology could do. And then you got a refinement in the understanding of how virtual care and digital health kind of fit into a larger ecosystem for healthcare. So with the public health emergency set to end, it's an opportunity to seize a new course and move away from the point solutions and consider a platform. You've got this opportunity to learn from the experience that you got over the past couple of years to figure out what you actually want to do as an organization to drive better patient care and better outcomes. You want to have a platform that's flexible and gives you the greatest opportunity to succeed in what will remain a shifting landscape for at least the next couple of years.